The second wave is crashing over Europe, and intensive care capacity is close to breaking point. Germany could hit its limit next month. France and Switzerland might crack by mid-month. Belgium could overrun capacity this week or next. What seemed like huge investments to expand hospital capacity now look totally inadequate. Warning bells should have been ringing in early July after the spring lockdowns were eased. But only a few recognized the vibrations that heralded a tsunami of new cases. The experts warned us, and for many countries, the second wave is already more savage than the first. Health systems are running at their limit in parts of Eastern and Western Europe. In Belgium, doctors and nurses are struggling to keep up. The incidence of coronavirus cases there is the highest in Europe at 3,956 per 100,000 people.
This used to be the recovery room for patients who'd had surgery. Now it serves as a makeshift intensive care unit for COVID-19 patients on life support. Hospitals in the Belgian province of Liège are now the epicenter of Europe's second wave and struggling to keep up.
We are not able to admit one new patient anymore. So if a patient comes in the emergency room with a severe disease, we have to transfer him to another hospital in Belgium until the Flemish part of Belgium will be also full.
Deveau tells us his team is not only short of beds, but also personnel. 1 in 5 nurses in the region have tested positive for the virus themselves, but the pressure is so high that those who don't have symptoms continue to work under strict safety precautions.
Doctors and nurses here are working tirelessly to take care of COVID-19 patients. Some of them are even infected themselves. But despite all efforts, the healthcare system here in Belgium has reached its breaking point as the overall number of infections continues to rise.
The actual number of infections is likely to be higher than the official figures. Across town at Liège's University Hospital, testing is ongoing.
I can't smell or taste anymore, and I have a headache.
Medics here can conduct 280 tests every day, but these tests are strictly for those who have a doctor's prescription. Family members, friends, or co-workers who have been in close contact with them but don't show any symptoms cannot get a test.
At the moment, we have so many positive cases. The problem is there are far too many contact persons. Given the huge number of people who have symptoms, we'd be unable to test them as well as all the people they've been in contact with, at least not with the amount of tests we have currently. If we had more tests, we probably could.
Back in the COVID ward, Dr. Deveau fears the lax handling of the crisis in summer will put him and his colleagues in a very difficult position very soon.
When you have only one bed and 10 people that are asking for the same bed, you have to choose between the 10, which one you will have to admit there. No doctors want to do that once in his life. You know, we are not doctors to do that kind of thing. We are doctors to treat patients, not to choose which patient treating.
Germany has started to take patients from Belgian hospitals. With infections expected to continue to rise here in the coming weeks, medical staff, already at their limit, will need all the help they can get.
Susanne Johna is with St. Joseph's Hospital in Rüdesheim. What sort of capacity does Germany have to take on patients from other countries right now?
Well, we have an average nearly twice as much ICU beds per capita than the rest of Europe. But currently in Germany, around 75% of the German ICU beds are occupied. So there is still room to move, and we could take patients, especially in border regions in Germany from other European countries, but there are regions also in Germany where the free capacity is below 10% and intensive care patients have to be moved to other hospitals, and that binds intensive care physicians, which is a very scarce resource. So when you think about free capacities, you have to keep in mind that the peak ICU utilization will be 2 weeks after infections have peaked, and they haven't peaked yet, so there's still a marathon to go.
When could they peak?
Well, nobody knows. It depends on how good the people bind themselves to the things to stop being close together and to wear masks and stuff like that. We have a new highest value today in Germany, nearly 20,000 new infections this day.
How practical is that, flying around COVID patients from one hospital or country to the next?
It's not very practical, especially when they are ventilated. So you have to plan that in advance and try to bring patients who are not that severe ill, who haven't been on ventilation yet. So it's not easy to plan that, because patients, we know that it's not good for patients being ventilated and have to be brought on a long term.
These staff shortages we hear about in Belgium and the Netherlands, they've seen nursing homes and hospitals ask doctors and nurses to keep working if they're tested positive but are asymptomatic. Is that safe?
I think that should only be done in a worst case scenario, because the majority of ICU patients still do not have COVID but other serious diseases. And when these patients contract the virus from infected staff, they are in grave danger. So you have to keep in mind, asymptomatic people, that doesn't mean they are healthy. So we think we should prevent this, and our staff has to stay healthy and get quick healthy. And this is very important, because if you have to let these people work with the virus, it's really not safe.
Well, why then is the EU not coordinating a concerted, a joint approach where we see countries helping out each other, but not everything having to be dealt with on a bilateral level?
Well, we could have done that on some methods. Let's say with the Corona app, we could have done that from the beginning altogether. We didn't do that. I don't know why. It would have been better. I think so, yes.
How foreseeable was all of this?
The second wave was clearly foreseeable. People traveled, they socialized, they enjoyed themselves in the summer, and we have tried to do as much as we could by building and buying respirators, by training people, but especially ICU nurses are in all in Europe a scarce resource, and it takes 2 years training on top of the regular nurses training. So kind of we have to work with what we've got, and we have now in Germany especially, we have it's very important to take away paperwork from them so that they really can spend all their time with the patient. And the other thing we could do is childcare, to improve childcare on hospitals, so especially during off hours.
What about high-risk groups? What else can be done to protect them so that they don't end up in intensive care in the hospitals? You have to reduce social contacts. Use of FFP2 masks are possibly, antigen tests are possibly, but these measures make only sense when used together. One is no substitute for the other, and when we are talking about isolating risk groups, we have to bear in mind that that in Germany, I know the number only for Germany, around 20% due to the demographics and due to the illnesses of our population belong to a risk group. So targeting only risk groups with a corona strategy will not work. Susanne, Johna, pleasure having you on the show today. Thank you very much.
Thank you. Have a good day.
And if you want to hear more about Europe's fight against COVID-19 in Belgium, you can download our weekly podcast, Science Unscripted. Our team travelled to the corona hotspot of Liège to bring you the latest. Time for our science correspondent, Derek Williams, to look into your questions on the coronavirus. Keep sending them in on our YouTube channel.
What impact is the pandemic having on the hunger crisis?
Predictably, COVID-19 is making it a lot worse. According to the United Nations World Food Program, which is the organization that was awarded this year's Nobel Peace Prize, the number of people worldwide who suffer from crisis-level hunger could almost double by the end of this year. It also says that the region hit hardest so far is Latin America. That's followed by Central and Southern Africa. And Oxfam estimates that if we don't do more to limit the social and economic impact of the virus, up to 12,000 people a day could soon be dying from the effects of undernourishment. Just to compare, even on the very worst days for mortality so far in the pandemic, there have never been more than 10,000 deaths attributed to the virus in 24 hours. I think that the most vicious aspect of this crisis is that, with the exception of a few countries, food is actually available in many of the places that are suffering most. Famine isn't being only driven by a lack of food, but also by the simple fact that people no longer have the means to buy it. The hunger crisis isn't only expanding rapidly because of disruptions in supply chains, although that's certainly contributing to the problem. It's also due to dropping income among many of the world's most vulnerable, the poor, who simply can't afford to buy food for themselves and their families anymore. And the crisis isn't just limited to regions that faced problems before the pandemic began. COVID-19 is now also impacting food security for people in middle and high-income countries, from India to Brazil to the US.
Derek Williams there. I'm Ben Fazulin. For any other developments on the virus, go to our website at dw.com/COVID-19. Bye-bye.